I am going to walk you through how I handle corneal ulcers and eye medications in one of my own animals. It seems like many of my clients seem intimidated by doing eye meds themselves, especially when it's more than one eye medication and multiple doses a day. But you totally can do it, especially if you set yourself up to make it as easy as possible and you have a plan of attack. Many corneal ulcers are straightforward and due to a traumatic scratch of the corneal surface. Many of them do have underlying causes that have to be diagnosed by a veterinarian. That's the situation with my alpaca, who has a seasonally obstructed nasolacrimal duct. If he was your alpaca, you'd probably need me to come out and do a sedated tear duct flush to really resolve the issue. Other underlying causes could be things like pink eye, entropion, or a foreign object. But even say that you recognize a corneal ulcer in an animal, but maybe your vet can't make it out for a day or two, and it's crucial to get meds started while you wait, this video might be helpful. If you've been in touch with your vet and you have a valid VCPR, you can always start a benign eye medication while you wait. And by benign, what I'm really saying is any eye medication that does not have a steroid in it. First and foremost, I'd like to catch the animal and stall them for the duration of treatment. Even if you have an animal that's easy to catch, after 3 or 4 days of catching them twice a day and jabbing them in the eye, all of a sudden they're not going to be so easy to catch. For this guy, I've prescribed autologous serum and an antibiotic ophthalmic ointment, which is a pretty standard plan. To make the serum, I collected his own blood, spun it down, and siphoned it off to use as an eye drop. Before putting the eye meds in the eye, I always check for discharge and wipe the eyes clean or even flush it with saline if it's really goopy. Here are a couple of important eye med tips that I wish more clients knew, especially when there are more than one medication to give and more than one dose a day. Number one is if you have more than one medication and one of them is a liquid drop where it's thinly viscous or watery, and the other medication is an ointment where it's thick and jelly, you should give the thinnest meds first and the thick stuff last. The thicker eye meds are designed that way to form a coating over the eye that lasts for a few hours. So if you give this first and then follow it up with a thin drop, you'll end up washing away that thicker gel coating. Number two, there needs to be at least 5 minutes between medications. If I'm giving back-to-back meds, I wait 7 minutes between the serum and the ointment. In this video, I did 5 minutes for the sake of the internet, but this time period allows for the serum to wash over the eye, coat the eye surface, be absorbed, and utilized before you move on to the next step. You want to make sure you have secure head restraint when you do something like this because no matter how many times you do it, as your hand approaches the surface of the eye, the animal will inevitably jerk its head either forward or backward. This could re-injure the eye, or if it's a really large animal and it jerks forward, it could hit you pretty hard in the face. Method of restraint will look different depending on the species and the tameness of the animal. For eye drops, I'll use one hand to pry the eyelids open, and sometimes I use my elbow to apply pressure to the face and hold it down. I put the drops right on the center of the cornea so they wash across the surface of the eyeball. For ointment, you want to place a thin strip of ointment inside of the lower eyelid. If you've gotten good at Fibonacci scoring, you'll be good at this too. Roll that lower eyelid out to expose the membranes and be sure that the ointment lies between the lid and the surface of the eye. Every time that animal blinks, it reapplies a thin layer of ointment across the globe. Now you'll notice the last thing I'm doing is just taking a good look at both of his eyes and making sure that they look normal. And while I have him caught, I'm also reaching through his fiber and evaluating his body condition score. If you have questions on how to do this properly, there's another video for you. Animals that are in confinement for medical care, especially alpacas, will be experiencing some level of stress. Even though I know he's eating, alpacas are more prone to gastric ulcers, which often manifests as weight loss, so it's something I can monitor before I end up kicking him back out to the pasture, never to be caught again.